So this is our last section. Similar with your professional values, you will be doing the same thing. You then need to memorize it and paraphrase it, use synonyms, and jumble the words for you to pass this examination. So for your evidence-based practice is a writing station, okay? You will be given 10 minutes to do the station. You don't need to perform anything apart from writing. So there are 5 scenarios. So what are those? So for your evidence-based practice, it talks about the evidence-based practice here in the UK. Again, not in the Philippines or not in other parts of the world, but in the UK. So we talk about diabetes. We have pressure ulcer prevention. We have female myocardial infarction. Remember, it's female. Later, we'll talk about why it's female. Next is smoking cessation and the use of honey dressing for venous leg ulcer. So um, these are the five scenarios for your evidence-based practice. So I will be giving you 2 examples today, and then later we will be reading the marking criteria, same as the previous topic. So let me read a scenario. So this is an example of your diabetes scenario. Okay. So you are a community health nurse. You are visiting your patient, Mr. Ted Baker, to give his due medication. Mr. Baker is also diabetic and is taking his oral hypoglycemic agents, metformin and glycoside. He mentioned to you that he is concerned about his blood sugars going down and afraid of having loss of consciousness like what happened to his wife, who is also diabetic. He is asking you what to look out for and what to do. Okay, so that is your scenario. So let's digest the scenario. So Mr. Baker is afraid that he might suffer hypoglycemia. He is not taking insulin, but is taking oral hypoglycemic agents only. So this is the article, okay, that you might be reading on the exam. An example. Again, this is not the exact article, but this is an example. So the article is hypoglycemia is an important complication of glucose lowering therapy in patients with diabetes mellitus. Attempts made in intensive glycemic control invariably increases the risk of hypoglycemia. A six-fold increase in deaths due to diabetes has been attributed to patients experiencing severe hypoglycemia in comparison to those not experiencing severe hypoglycemia. Evidence from several observational studies such as the UK hypoglycemia study, a retrospective questionnaire-based study from Denmark, and the diabetes audit and research in Tayside, Scotland, study indicates that the risk of hypoglycemia is particularly high among patients treated with insulin. Overall, insufficient food consumption was the most common cause identified for severe hypoglycemia, 43% in type 1 diabetes and 47% in type 2 diabetes. It is important to educate patients with DM about early identification of hypoglycemia, the symptoms such as excessive sweating, feeling faint, lightheaded, blurred vision, new confusion, or nausea it causes, the various preventive measures, and the available treatment options. So this is an example of your scenario for your diabetes, okay? So let's now head on with the marking criteria and how are you going to actually pass the station? So what is required of you to pass the station? So it will ask you, number one, on the marking criteria, to summarize the main findings from the article summary and draw conclusion, making recommendation for practice. So you have to summarize the criteria and to do recommendations for practice. You have to write legibly. Number three, so these are now the things that you have to tell the patient. Okay, so you have to inform. After this slide, I will give an example. So number three, inform the patient that he is likely to suffer with hypoglycemia and he is not prescribed with insulin. However, hypoglycemia remains a serious concern and he should be vigilant to monitor his blood glucose levels and to recognize the symptoms of hypoglycemia. So going back to the study, it's saying us that hypoglycemia causes more death, okay, than compared to patient with higher blood sugar levels, okay? Because remember, we all know that people with diabetes, they're really cautious sometimes. They tend not to eat, okay? They tend not to eat as shown or as written on this article because it says here overall the causes of hypoglycemia is because of not having enough food. Okay. So number four, you have to advise the patient that hypoglycemic episodes are often caused by diet-related factors, like what I mentioned, such as missing a meal or not eating enough carbohydrates, and discusses the daily recommended amount of carbohydrates. Number five, you have to advise the patient to observe the excessive sweating, feeling faint, lightheadedness, blurred vision, new confusion, and or nausea, and of course, call 999 if he experiences any of the following symptoms. Okay, so this should appear on your paper. Number six, you have to advise the patient to inform friends and family that if she appears confused or loses consciousness, he may be having hypoglycemic episode and will need emergency help by calling 999. And lastly, you have to inform the patient that an episode of acute illness may cause irregularities in blood glucose, so he will need to monitor her blood sugar more frequently and report any changes. Okay, so on your screen are the things that you have to write to pass your evidence-based practice. So, Emmer, how am I going to write that? Or how am I going to transfer that on my paper? So, on my next slide, this is an example. Again, guys, I only selected couple of items, but on your examination, you have to write everything, okay? The one on your left, on the left-hand side of your screen, the example of the paper that you will be using on the examination. So it says here, a silent station, evidence-based practice diabetes. So let's say number one, summarizes the main findings. So this is an example of the summary, okay? The article talks about hypoglycemia as an important complication of glucose-lowering therapy in patients with diabetes mellitus. Severe hypoglycemia is attributed to higher deaths due to diabetes. According to the studies, risk of hypoglycemia is high among patients treated with insulin, but overall, insufficient food consumption was the most common cause. It is important to educate the patient with diabetes about early identification and symptoms, available treatment options. So that is just summarizing the article. So let's talk about number three, okay? So this is an example on how you're going to rewrite number three on your paper. Again, guys, you need to write everything. Of course, you're not writing right clearly and legibly, okay? Of course, you're not writing number two. That is self-explanatory. So number three, I will inform Mr. Baker that he is less likely to suffer with hypoglycemia as he is not prescribed with insulin. But I will emphasize that it remains a serious concern and he should always monitor his blood sugar levels regularly and to recognize the signs and symptoms of hypoglycemia such as sweating, feeling tired, shaky, and dizziness. That is it. So I just paraphrase the stuff. Okay. So that is how you're going to write it on your examination. An example. Again, this is not the exact answer. You could always change it, but remember the main point should be there. Okay. Let's say another example is for number four. Okay. On the marking criteria, it says they advise the patient that hypoglycemic episodes are often caused by diet-related factors such as missing meals or not eating enough carbohydrates, emphasizes the importance of eating regular meals, and discusses daily recommended amounts of carbohydrates. So what you're going to write on your paper on the exam is as shown as below. I will advise Mr. Baker that hypoglycemic episodes are often caused by diet-related factors such as missing meals or not eating enough carbohydrates. I will also emphasize the importance of eating regular meals and discuss the daily recommended amount of carbohydrates based on his needs. Again, so just me basically rewriting the thing and just paraphrasing it appropriately. But remember, guys, when you're paraphrasing, make sure it's the same thought, okay? It's the same thought. And it applies for the remainder of your criteria. Are we all following? Hopefully that is clear.